take it anywhere, but get it hooked up so you're ready and you can move. Or at worst case scenario, drive around the block, it might fix the colic. The next thing you do is start walking that horse, or if it was a perfect world, you have someone walking the horse while you're hooking the trailer up to be ready. But if anyone has noticed, if you have some gas and you get up and walk around, you're probably going to fart. Same thing for horses, and we want those horses to pass that gas. The other thing is you don't give the horse food, you don't give the horse water, because if it is an impaction where it's blocked, I don't want stuff building up in there. The next thing you do after you started that is call the vet. Because a lot of times I'm telling you, walk the horse around for 20-30 minutes, see what's going on, see if the horse calms down. If it doesn't calm down in that 20 or 30 minutes, that's where we're like, okay, well, get it hooked up, haul on down, but that gives us time to prepare and be like, okay, here we are, and we can get ready for you here, and you can have time to, take a deep breath, get the horse down here, and be prepared to get the horse down here. We can work up the medical cases, and the nice thing about having them here, I've had people with colics, by the time they get the horse down here, I do an exam, and the horse is fine, because the gas got moved around after the trailer ride, and life goes on. So instead of having a full colic workup, or a lot of times we go through a lot of the motions, you have less of a workup because a lot of the problems are already resolved. And that's better for everyone, especially the horse. If it is a surgical case, I am going to be able to hopefully tell that by palpation, by passing a tube, and if I see certain things, I'm going to be like, okay, it's time to go to Lexington. We have no other options here because we can't fix this without opening the horse up. And then you're already hooked up with the trailer and you're ready to go down to Lexington, which is one of those times you actually need to go to Lexington, because I have done colic surgery in the field. It's not fun, and I don't really want to do that. So that's something I'm going to get you down to Lexington for. But again, there's a few steps. You hook the trailer up, you get your horse walking, you call us. Hopefully by the time you get here, everything's good. If not, we work it up and we either get it better or we send it home. The nice thing is about getting it to the clinic, at least from my perspective, and probably from your perspective, because if both of you call for the colic at the same time, I have to choose which one of you to drive to. So, I don't know who's sliding me the cookies from the meal tonight, but, that's probably the best way to do it. But if you bring them here, I can see both colics at the same time. And we'll talk about that a little bit more later with kind of the lack of vets these days. So yeah, any questions about colic? Because I know that's always on everyone's mind. The next thing, grain overload. So that's where the horse breaks into your feed trough or the feed bins and eats way, way too much. Usually it is getting all that grain that you're like, I don't want to feed it this much because it'll be really rich, and you're like, now the horse ate everything. So short term, that could cause colic. So that could be a reason the horse is colicking. If you don't know that happened, we might be evaluating it. Long term, that can cause laminitis. So what can we do? A horse's stomach is really already empty within 45 minutes. So if that horse just ate this stuff, and you got there 45 minutes later, I can't really get it out. And horses can't vomit, so if they're sick, they're not getting it out. So what can we do? Well, preventative things. What I'm worried about with laminitis is when all that food gets in there, gets to the gut, it causes an increase of bad bacteria. Those bad bacteria causes endotoxins to be formed, which go through the blood, and if they get to the horse's foot, they're going to break down things in the foot and cause laminitis. If we can stop that, then we've prevented the emergency. So what I usually do for that is ice the feet. For the next 24, 48 hours, you get a slurry of ice in a bucket or something, and you keep those horses' feet iced. That's going to cause vasoconstriction, where the blood vessels tighten down. The blood doesn't get down there, which means the toxins don't get down there, which might prevent a future problem. Also, If you have a current VCPR, I recommend having some Banamine on hand. So that way, if you have an emergency like this, or colic, you can potentially give some Banamine, and that is going to bind up those endotoxins and stop them from getting to the feet and causing our laminitic problems. It might also help some with the potential colic or upset stomach they're getting as well. But is there anything I can do right away? Probably not. We just have to kind of wait and see. So what I usually want to do is within the next 48 hours, I want to get some blood work, examine the horse, make sure we aren't showing signs of laminitis, and make sure that the internal organs haven't been messed up by all that grain causing all those toxins. So that's something, it's an emergency, but is it an emergency you need to rush into or into the clinic for? Probably not. Let us know, get scheduled, but we're probably going to tell you to do more things at home because that's going to do more good there than it is bringing the horse down here and letting us look at it and then tell you to go home and do that. So it's saving a step and helping the horse in the meantime. So dystocias, cattle dystocias, obviously we can deal with a little bit better. Horse dystocias are a pain in the butt.
Will you define?
No, say what?
Will you define that?
Oh, I'm sorry. Dystocia is a difficult birth. When the cows are having the calves and something goes wrong, we call that cattle dystocia. In the case of horse dystocia, horses are having difficult births. Cattle are much more forgiving. We have a lot of time with cattle. I just don't get it. I want to see a cow that has, a baby that's stuck in it, but I have a lot of leeway of getting those out. Horses, you just don't have that time. If you find a horse that hasn't birthed out, it's full, and once it's started, about 45 minutes, an hour, load it up, start coming here and call on the way kind of thing. And say you're coming, and we walk out, and I will spend about 20 minutes on it. If I can't get it in 20 minutes, I am sending you to Lexington, and I'm telling you to speed. It's something that would need surgery on, and we just can't wait around. Horses are much harder to get foals out of than cattle, and that's something that needs to be done quickly, and we have the benefit of surgery here, or just an hour down the road. And again, that's something, like I said, that's why we have triage. I can tell you what to do. If I'm out on a farm call and you haul it in, well, you're halfway there. My staff's going to tell you just go to Lexington. Because this is something that it needs to be dealt with quickly. So this is one of those true emergencies that needs to be dealt with quickly. So some randomness. Choke. Choke is not choke where there's something stuck in the esophagus, or I'm sorry, in the trachea, is where it's stuck in the esophagus. Everyone gets really worried about choke because they think the animal can't breathe, but in horses, choke is food in the esophagus. I don't really look at this as an emergency, I look at it as urgent. What I tell most people to do is hold the head up, tie it up so it's at a normal riding level or like a horse was just standing up straight. Leave it that way for 45 minutes, an hour, hour and a half. Most chokes are going to resolve when that fluid, all the saliva goes down into the esophagus, will break that up. The next thing I'm going to tell you to do, once you call me and say that's going on, if after an hour and a half it's not better, is haul down here. Most of the chokes after that, after they've been hauled down, will resolve themselves in the trailer ride. And I've had a few people that get here and they're like, oh, I thought this was horrible, and I'm like, it's all fixed. But that's better than it being a bad choke where I have to pass a tube and break up the grain and whatever is blocking that. But again, choke is in the esophagus, they can breathe, and most of them, if you get the horse in the proper position by holding its head up and letting that saliva go down into the area that's been blocked, it's going to unblock itself on its own. The trailer ride will do it, or the severe ones I have to work on here. But again, that needs to be seen, but it's not one that I'm telling you to rush down for, because again, if you call me up, describe it, I'm going to say let's wait an hour and a half. If it hasn't resolved itself, I want to get moving. But again, that's where you be calm, you take a look at everything, and then you kind of see where we need to go. Respiratory issues. Those are probably chronic in nature. So I usually don't classify those as emergencies. You know, they're urgent. If your horse is having some trouble breathing, I want to get it seen. And if I can get it in that day, I will, but the next day is probably fine too. Most of those have probably been going on a little bit longer than we think. In the exclusion of, I have seen some stings or bug bites cause some allergic reactions. Again, be calm, look at the whole horse. Is the horse breathing? If the horse is breathing, you're okay. If the horse isn't breathing and those airways are being constricted because of all the swelling, that's when we start getting some problems. So there are emergency situations of breathing issues, but thankfully most horses do pretty good, and I've seen a few cases of allergic reactions causing airway problems, but not many. And when you're seeing that heaving down in the lungs and on the chest, those usually aren't as acute or as sudden as you think they might be. Swellings, that kind of goes along with our airways. If it's swelling up and blocking an airway, that's a problem. Most other swellings, you know, I want to get that seen. It's urgent, but we don't have to drop everything and run out right then to get that taken care of. Lameness is most likely not an emergency. If there's a broken leg, that's something we need to get seen right away. But something that's been limping for 3 or 4 days, it does not need to run down at 5 o'clock right when we are, you were scheduled at 5, it was fine. But you don't need to run down when you find it at 5 o'clock. You call us, you get scheduled the next day or something, because horses can do fine on 3 legs. And most lamenesses are not, they're holding their leg all the way up, they're a little touchy, and they're tender on it. So most of those are urgent. We want to get those scheduled, we want to get those seen, but again, not always run right down, drop everything. And remember, a lot of people get nervous hauling a horse that's lame on a trailer. If you've ever tried to trim a horse, they can stand on 2 legs for an extremely long time. So I think they're going to do fine in your trailer. I've seen farriers, when I have groups of farriers, they will pick up this foot and they will pick up this foot and they will trim at the same 2 hooves at the same time. These horses can do better on 2 feet or 3 feet than you think. The trailer ride is probably not going to knock them over, and most trailers, they're kind of secure anyway, so they get a little weight distributed off them. Really bad cases, let's say it's a front leg that's injured, you could back the horse into the trailer, and then that takes the weight off the front legs, because when you're going with just like a 2-horse trailer and you come to a stop, most of the weight is going onto the front legs. So if it's really, really bad and you're concerned, you could back the horse in. So yeah, if your horse is eating, if it's drinking, if it's walking, it's probably not an emergency. That's something that we want to see, but it's probably not an emergency that needs action right now where we drop everything. Neurologic cases kind of go either way. Neurologic cases like EPM, if your horse is down because it has this bad disease, it's an emergency, but it's probably taken months to get that way. If it's taken months to get that way, I can't fix it in a day, in a night. So yes, we want to get those things seen, but remember, there's only so much we can do, and especially when something's been going on for months and months and months, it's really hard to change that in a night. So that's why when you call us and we hear something's been going on for months, we're like, we want to get it seen, but if it's been going on for months, we know we can't make a drastic change, so we sometimes aren't pushing to get that in that day when we have other things that are more acute or more sudden. So timing. Like I kind of said earlier, realize if the bleeding is significant enough to kill a horse, it's going to be dead before you and I can do anything. There's a fungus that can grow in the guttural pouch of horses. It will eat away at the carotid artery, and once that breaks, the horse will bleed out in 30 minutes. Even if the horse was here and that happened, I don't know that I could get in to tie it off that quick. Nor do I really want to tie off a carotid artery to the brain. In most cases, when you find these lacerations or big wounds, you're not only not at the vet's, but you're 30 minutes away from a vet, 30 minutes away from getting the trailer hooked up to get down. So there are some things we can't do or we can't fix. But if you can stop the bleeding, you have time. So that's where I was talking about be calm. Because the things that are going to bleed out, you probably can't stop. The things that you can stop, that you're going to be able to with some pressure, some bandages, and just some patience. And remember, horses have a lot of blood. They can lose a gallon or two of blood before it's a problem for them. And blood looks like there's a lot more of it on the ground than there actually is. Red just really makes it pop in your eyes and you get worried. But a little bit of blood can just cover everything. So remember, there's probably not as much blood as you actually think there is. And really most things aren't emergencies. In the veterinary world, a vet gave me some advice way long ago, because he's old now too. He said most vet appointments aren't emergencies, and he was right. Hit by cars, everyone's like, oh my gosh, this dog's been hit by a car. I saw one hit by a car. They hit their own dog, and they brought it to the clinic in 10 minutes, and they called me, and I was there in 15, and by 20, the dog was dead because it was bleeding out internally. Like I said, we weren't going to be able to stop that. Now, let's see, 9 out of 10 hit by car cases, we see them, I'm going to stabilize them. Even if I do surgery, I'm going to wait a day. We put the dog and let it rest in the cage. We let it rest at home. Then we do stuff because I don't want to do surgery on a shocky dog. And most of the time, these cases are going to be fine. And that's one that everyone thinks is an emergency. And I'm like, well, yeah, it's an emergency. We want to see it. We want to start our plan of action. But, you know, it's the outcome, we have time to deal with that. With horses, one of the things that makes things become more of an emergency than they are when we haven't planned ahead enough. And so I always say plan now so you aren't freaked out later. And that planning a lot of times is getting the horse trained to get on the trailer, getting the horse, getting the trailers so you have a backup trailer. If your trailer or your truck breaks, you know, don't piss off all your friends, especially if they own things that you might need to use at some point. And just start working with your horses from a very young age so they are fine loading, so they're fine unloading. So when they are freaked out, they get on a trailer easily. And I know it's not always easy because my own horse has his own problems, but if you do that planning now where you know that your horse can load, you know if your truck and trailer go down, you have a backup, it's going to prevent a lot of emergencies in the future. Because you're going to be calm because you already know that you've dealt with the triage of the situation and you know that you can get your horse where you need to get it. So before we get to the next section, any other things, questions here like, oh, this is an emergency that he didn't deal with or what I think is an emergency? Anything curious about? That's kind of the biggest ones. I mean, cuts, colic, laminitis is not exactly an emergency. So those are the big things I think horse people think about. So now I want to talk about how vets are kind of dealing with the emergencies and stuff. So where were we then and now? I started in 2010, and there were about 18 large animal vets in northern Kentucky, kind of depending on which counties you count, because I know not everyone thinks this county is in northern Kentucky. But it's 2023 and we're down to about 6 vets that do large animal in this region. Only 2 of those that I know work on cattle consistently. I'm one of those 2. So the dynamics have changed a lot. And this is not just here. This is a national shortage throughout the country, and it's also in small animal. Now, small animal is lagging behind, but they are having some of the same issues. Cattle are the worst. Horses are, well, I'll say ruminants, cattle, goats, pigs, the worst. Horses not far behind them. Small animals still has stuff, but even they are seeing some of these problems and predicting it in a few years.
Why?
There's a lot of dynamics for this, and some of that was discussed. I don't know if this is bright. They just had a meeting down in Lexington where they put all the large animal vets in a room to talk about this and what they're trying to do with it. And I was like, well, if a meteor hits, well, there goes the vets in Kentucky. So I was a little concerned about that. But it's a lot of things. One, the finances for getting vets into large animal. Two, we've got, I think, clients in general. There's kind of, one of the questions at that meeting was, is it a lack of vets, or are there a lack of people actually asking for the care from vets? And some of that goes on, because this guy, he kind of like my practice, you know, I'm here, the doors are open for large animals, and he said he's started, and his practice was 90% large animal, 10% small animal, and he was like, it's 25 years later, and I'm flipped to 90% small animal, 10% large animal, and I've never done anything but just say, oh yeah, I'll see your dog. They don't advertise anything like that. So and then I see it at the point, I'll bring cattle up. Cattle people in general call me every other year. So they're not using us for preventative stuff. They're not using us for things besides emergencies that happen every 2 to 3 years. So vets are not able to pay the bills off of an emergency every 2 to 3 years. So that's some of the issues. Also some of it, as Daniel can attest, vet school prices are going up, or to pay for vet school is hard, and it's harder in a rural area for me as a practice owner to say I can pay him what he needs to come out and then be able to practice on large animals, because the jobs where there's more money will be a small animal clinic with hours from 9 to 5 and salaries 30, 40,000 more or more than the large animal people can pay. So I mean, it's hard for someone to say, well, why would I go work long hours and potentially, because a lot of vets are doing late night emergencies and then get paid less when I could go get an easy 9 to 5 job. Not that it's always easy working small animal. Sometimes there's dogs out there that might want to eat you or something. No, not here. Not here. So yeah, some of the things I'm doing is changing here at the clinic to try to adapt with that, or adapt to that, so that I can draw in someone graduating who wants to work on large animals. And you know, there's a few different ways I'm trying to do that. One is I've cut off the after-hour large animals. We will see if you call us before 6, we're going to get you seen, but I've turned the phone off after hours. Because I'm seeing these clinics that have multiple doctors and they are not seeing after-hour emergencies. And I'm like, why am I here seeing after-hour emergencies, getting paid less than them, and then not being able to be awake when I come in for my clients during the day that have scheduled and everything. So I'm trying to entice young vets to come in by saying, well, I can't pay you as much as you'll get at that small animal clinic in Cincinnati, but at least you won't have to do after-hour emergencies, and you can do the fun stuff where you get covered in poop and have your hand up very large animals' rear ends. So yeah, no after-hour phone services, And I'm requiring more to be seen at the clinic. You're probably seeing where I want to see everything at the clinic unless it's a down animal, cattle, excluding like 75 pound or 100 pounds or smaller cattle we're telling people to bring in. Or if you have less than 5 animals, we're saying bring them in because there's only 6 vets around seeing large animals. So I can't drive to all these places and have time to see everyone I need. And the other thing is I can't make enough money doing that to pay all the bills. So to have the nice equipment to take care of the horses, like my x-rays, my x-ray generators, without the small animal. So I have to have a small animal to bring in the supplies I need for the large animal. So I can't see everything in the day to make that work.
I was going to throw out the stocks too that help so much in keeping, you kind of touched on that, in keeping clients safe and the horses being able to work on them better. But also, people always forget because it's like when it's your horse, like I'll do anything. But he has to keep himself safe as well, and those stocks have helped so much because if he gets injured, then he can't help anyone's horse until he gets